Okay, can you see all the slides?
Yes, Doc.
Okay. So good morning, everyone. Today, our topic is on arthritis. I think a lot of people are aware on arthritis and also all the joint problems. And also inflammation happen in the body, joints, and also muscles. Okay. So many people nowadays have this kind of problem that never ending in a modern medication industry, that only given a steroid or painkiller to suppress for temporary solution only. Okay, today we will go on these solutions. What are the best solution in Ganotherapy, and some of the holistic practices that we can follow accordingly to make sure we are 100% free from this arthritis. And today also we will discuss on the type of arthritis, all type of arthritis, and what is the cause of the arthritis and how to do the prevention. The important is the prevention. So once we know the prevention, we have no problem, and we no need to worry about this arthritis. Okay. So let me go on later. All the questions we can ask later. That time we are in Q&A session. We can explain more about questions and answer for all the solutions and questions for you. Okay. First of all, we see what are the types of arthritis. Okay, we have so many types of arthritis. People always know about joint pains, muscle pains, body pain, so all these kind of things. And but today we will discuss more detail on it. Here we go on. Okay, see here we got 4 type of arthritis category. The first is like arthritis. We call it, normally you go and see the doctor when you say you have the joint pain, all these things. Okay, it is a swelling and tenderness on one or more joints. The main symptom of arthritis, joint pain, stiffness. So you will have so you cannot move your finger. Your finger become very stiff and it's not free move. Okay, which typically worsen with age. When you're getting older and older, the most common type of arthritis are osteoarthritis and rheumatoid arthritis. So first you start with arthritis, then you follow with the osteoarthritis and rheumatoids. Okay, what is osteoarthritis? Causes cartilage, the hard and slippery tissue that covers the end of bone where they form a joint to break down. Okay, so you can see on the left hand side there's a picture on healthy joints, osteoarthritis and rheumatoid arthritis. So when you got rheumatoid arthritis, you are leading towards, in a longer run, you are moving towards the rheumatoid arthritis. That means arthritis, osteo, then end up with rheumatoid. Okay, what is rheumatoid? A disease which in the immune system attacks the joint, begin with the lining of joints. So why the immune system attack the joints? Okay, in long run, when you keep on taking painkiller, your immune system will be suppressed totally, and the immune system start to work indifferently and start to attack your own joints again. So that's why we need to avoid most of the drug categories, okay, steroid categories that given for the arthritis issue. So far in a modern medication view, we not seen a proven medication system, but temporary system got. When you go and get for temporary got, but in the long run it become worse. Once it become arthritis, osteo and rheumatoid, you have no choice anymore already. The more and more drugs they will prescribe to you, and slowly your system become more worse than as before. So uric acid crystals which form where there's too much of uric acid in your blood can cause gout, infection or underlying disease such as psoriasis, lupus, and can cause other type of arthritis. So you must understand where all these things started actually from the acid in your body. If you can maintain the acid in your body from the day one, okay, from the day one before you get the arthritis, you become more better and better. Because in an industry, in a modern industry, we can see there's no solution for it, but most of it you will be given with the immune suppression medicines or methotrexate or painkillers to suppress some of your immune system and also some of the pain, and also to reduce the attack in the long run. It will attack, but by taking the medication, in 6-month attack, you will buy some time, but you never come out from the attack. You never create a path to release from the attack, so you cannot run away. Okay, so we go on. Okay, this is the symptoms. Most common symptoms in arthritis involve the joint, depending on the type of arthritis. So most of the time you will have a pain in joints. Okay, joints. All our joints have the pains. So wherever the arthritis attack, the pain will be started. Stiffness, you can see the stiffness. The movement will be reduced. You can't move as freely. And you can see the swelling, inflammation on that area, reddishness happen in that area, and decreased range of motion. So in the long run, when your body start to stiff, start to pain, start to swell, okay, you can't walk. So your motion, your movement become very slow, because everywhere it start to hardening. Okay, every joints become hardening. So you can't walk properly. Okay. Okay. So what are the risk factors? These are the risk factors that you can see from the industry, modern industry. They come out with so many factors that might be true and might be not true. But end of the day, we look at it also. Family history, some type of arthritis run in family. So you may be more likely to develop arthritis if your parents or sibling have the disorder. Why these things happen? You see, why is family history happen? Whenever you are in the family, whatever food they eat, you eat. Whatever drinks they drink, you drink. If they late eat, everybody late eating. So these are the things that are happening, and the disorder become almost the same disorder happening to all the people. Sometimes people always say, oh, when you get diabetes, when your family got diabetes, your father got diabetes. Why? Because when you eat same rice, when you drink same kind of food, drinks, when you put the sugar, same amount of sugar everybody taking. That's why they call it under the family history. But once you come out from that history, and you come out and you change your own order of your food, okay, of your lifestyle, things will change. You can't follow your history anymore already. Okay, but still a lot of doctors are following family history. Actually, if you really change, you can change totally. Second thing, the age. The risk of many types of arthritis, including osteoarthritis, rheumatoid arthritis, and gout, increase with age. Yeah, so okay, based on age, there will be a lack of calcium, lack of vitamins, lack of minerals, lack of nutrition happen according to the age factors. When you are 20 years old, your food is different. When you're 40 years old, your food is different. When you're 60 years old, your appetite are different. When you're 80 years old, your appetite are different. This will cause some of the reduction happen in a nutrition fact in your body. You can't maintain the same nutrition fact. At the same time, you also never maintain your activity. Lifestyle changes never happen according to the age. Based on the age, you are losing a lot of things that you've done in 20 years of age. That's why you must follow. You must not change, follow the same lifestyle, whatever age you are. Okay. Your sex. Women are more likely than men develop rheumatoid arthritis, while most of the people who have gout, another type of arthritis, are men. Okay. So this is actually, when you see, it's also depending on the lifestyles. Okay. According to the industry, they say that women get more rheumatoid arthritis, men don't have don't have gout. See, whenever you see rheumatoid arthritis, all these things, almost same things, same problem. Okay, only when it happens in a different area, you will start to put a different kind of name. But in reality, the cause is only one. Okay, your acid in your body is increasing. Okay, you don't balance your acid. Later, you learn how to balance the acid in the body to completely prevent from the uric acid entering the body, and we completely prevent from the arthritis. Okay, previous joint injury. Okay, this might be true a bit because long term you have an injury, then you never go and take a proper medication or system or training or exercise or physiotherapy. End up the injury is become more and more, and it start to develop arthritis or damages in the joints. Okay, it might be actually I can category it not under the arthritis, might be under the joints injuries lah. But when acidity is high, the injury become more prone to this arthritis lah. That can be done lah. Okay, obesity, carrying excess pounds of stress and joints, particularly knee. Okay, this is a bit true. Obesity is not true. Sometimes obesity people also don't have problem, but people with not obesity in correct BMI have this problem. So it's completely different from what we are talking about. But it's true when the stress is playing a big role in arthritis, because when you stress, you don't eat properly, you don't sleep properly, you don't do a proper activity, you don't give a proper lifestyle to your system when you are stressed. Okay, and carrying a lot of heavy things. Okay, this also can affect the joints because heavy things might always pressure up the below waist equipment, especially your joints, all these kind of areas. Okay, joints, finger joints, knees, what do you call the ankle, the area of your spinal, lower spinal, all these things. When you take carrying heavy things can be damages. Okay, can be damaged. So this is also can lead towards the osteoarthritis, because the joint and joint start to attack each other, and in the long run it impacts the system. Okay, so that can cause the obesity, the arthritis in a longer run. Okay, so we go on. So now we already see on that environment is more on the medication industry, where they're looking the arthritis there. Okay, but we start to see in a Ganotherapy and holistic views. Okay, in Ganotherapy and holistic views, we are looking it differently. Okay, we are looking at different angle. Why we are looking different angle? Because we know the cause of what they have been allocated is actually true, but only 30% is true. But in the real ways, where is the attack is from internally it's happened. This is what we have learned. And once we balance the internal issues, everything go back to a actual ways. Okay. So first we see the Ganotherapy solutions. What you can take, you can apply Gano oil at the affected area 3 times daily, soak with warm water. Okay, the affected area using Himalayan salt or Epsom salt 2 times daily. You can mix Codipine 10 ml, vinaigrette 5 ml, 1 scoop of Richelieu powder, mix warm water. You can drink 3 times daily. Androgen 2 capsule 3 times daily. You can take additional spirulina, bee pollen. You can take black cumin, that is additional things you can take. Okay, more enzyme, more Z. That one all additional things. For arthritis, Moringa is also playing a big role to reduce the pain. When you have a very bad arthritis, a very bad pain, you can take 1 bottle of Moringa and you can drink every day 1 bottle. That also helps your system actually. Okay, this is the solution on Ganotherapy. Okay, what you can eat to reduce, to balance, to repair back all the joints and affected areas. Okay, what we see in a holistic way. Okay, so in a holistic way, when you see mobility, the first problem actually started from your meal, actually, from your meal. Where I see the problem is always delay in eating. You see, Our body work with sunlight. We are work with nature. Our body connected with nature. So when you connected with nature, you must understand that our body is always communicate with the nature, with the sun, with the moon, and it also detect where is the sun. When the sun disappear, it become passive. So our body have active. When active, serotonin hormone will be activated in the daytime. When night, our melatonin hormone will activated, so it become passive. So our body become passive. So that's why the first thing you must put in your mind, when the daytime 7 a.m. 9 a.m. is your breakfast. This is the time that acid hydrochloric in the stomach will release. So you're supposed to get your breakfast on that time. And 12:30 to 1:30 is your lunch time. 4 to 5 is your tea time. 6:30 to 8 p.m. is your dinner time. So you must make sure in this time frame you get your meal. You must get your meal. If you delay, let's say you delay your breakfast, you're taking on 12 o'clock. Okay, so morning acid that produced in your stomach has been go down into your small intestine, absorbed into your bloodstream from your small intestine. Now the first acid, the medium acid for your breakfast to be used for your breakfast has been utilized and absorbed into your bloodstream. Okay, now 12:30 to 1:30. So because you delay your breakfast, you eat your lunch, your lunch at 12 p.m. So in 12 p.m., okay, at least you balance your lunch. But in the morning acid, you already absorb into your blood. But 12:30 to 1:30 acid is still okay, and you will miss your tea time. Okay, and 6:30 to 8 p.m. You can get your dinner. That one okay. Okay, but sometimes because a lot of people, when they delay in taking breakfast, they start to take breakfast 11 a.m. When they start to take 11 a.m., okay, the 11 a.m. food will be digested 12:30 acid. Okay, so your lunch automatically will push to 4 or 5. So in the 4 to 5 p.m., actually our stomach only able to produce a minimum amount of acid hydrochloric that is being used only for tea time. But you whack your lunch. That food cannot be digested and need to be wait until 6:30 to 8 p.m. to digest again. So that means you keep your food there. So end of what you are doing, you are not balancing your acid hydrochloric according to time. End up the acid absorbed into your small intestine and absorbed to your bloodstream and absorbed to your towards your body. Okay, all this acid will start to penetrate into and stay into all the joints and bones. When you start your days every day, delay, every day acid absorbing into your bloodstream and keep on stay into your joints, bones and muscles. This in a long run will become a infection, become a crystal and start to attack your bone system. Okay, and after 8 p.m. our body will change to melatonin effect. Don't eat anything after 8 p.m. Okay, after 8 p.m. don't eat anything. Food that you're taking after 8 p.m. cannot be digested, and it will be digested the next day morning when breakfast time, because when our body hormone start to push the melatonin, okay, our body become passive, and whatever food you eat not digested and keep in your stomach, and the next day digested become more acidity and the food is spoiled in your stomach. Next is after 8 p.m. don't take any solid food, but you can go for liquids such as like a bit cereal, milk, a little bit of cereal, little bit of oats, a cocoa, juices. This is okay for night time, but after 8 don't ever eat anything. Remember back when you're small, 8 years 9 years old, what is your last meal you get? What time your father mother give you a breakfast, and what is your last meal will be, your dinner will be before 8 exactly. But nowadays after we grow, we totally change the time frame and we eat ourselves with your own lifestyle. That is wrong lifestyle that can create a lot of damages in your body system. So when you eat 6:30 to 8 p.m. when you complete your dinner, okay, then you already go into a starvation mode that means the next food will be 7 to 9 a.m. So that means from 8 to next day 11, 7 a.m. you will have like 10 to 11 hours starvation. In this starvation period, okay, your acid, your cholesterol, everything will be balanced by your body. So from the day one you born, you have around 10 to 11 hours starvation that naturally happen every day without a single missing. But when you grow up, you start to change your actuality and become more damaging in your body. So remember that always follow the system. Okay, follow the time frame is very important. People always say, I'm not hungry, so I don't eat. Yeah, if you don't have a proper bacteria in your stomach, you won't feel hungry. That means something wrong with your stomach. In actuality, people will get hungry at 7 to 9 a.m., 12:30 to 1:30 p.m., 4 to 5, 6:30 to 8 p.m. So tea time is not very important, but if you take or not take, nothing much effect. But your breakfast, lunch, and dinner is a must. And after 8 p.m., stop all your food. And if you feel like something want to drink before you sleep, maybe 15 hours or 30 minutes before sleep, you can take a glass of milk mixed with a small pinch of turmeric, then mix it and drink to make sure you don't get hunger 3 o'clock in the morning. Okay, so apart from this time frame, if like 7 to 9 a.m. you take your breakfast ready, let's say 11 o'clock, 11 a.m. you feel hungry, that hunger is a water hunger. Remember, don't put any solid food. It's just a water hunger. You just can take some water, drinks enough. Don't put anything. So make sure you wait for 12:30 to 1 o'clock and then you take your lunch. So remember that, follow accordingly, then you can see a lot of changes happen to your body. Okay, and how to balance your acid hydrochloric in your stomach? Follow the time frame exactly. Munch your food and drink water after 30 minutes of your meal to make sure your food is fully. Once you munch your food stop going to the stomach able to digest the food using the acid hydrochloric. If you put water, the acid will be diluted, then your food is not properly digested. Okay, sleep time is 11 p.m. must be in the bed. Sleep is system control, but body rest is your control. Remember that sleep is not yours. Sleep controlled by the system, but body rest is controlled by you. So by the time 11 p.m., you just go to bed, close your eye and sleep. The moment you close and sleep, your body already sleep. Only your mind is not sleep. Nobody in this world can ask the mind to sleep. The mind will control by the system and it's a natural. So it's using a sin note, up for a while, down for a while, up for a while, down for a while. But when you close your eye and sleep, your body automatically go down to shutdown mode. Okay, remember that. And you can wake up between 5 a.m. to 7 a.m. in the morning. At least you'll get 6 to 8 hours sleep daily. This is a must. You must give to the system. And 30 minutes of the exercise and the basic stretching is enough for daily basis. And drink water sick by sick, and always don't flood it your system. When you flood your system, your kidney need to pump more and have to pump back all the water that over accessed in your body and to release it out. That is actually you are damaging your kidney more. You suddenly give a lot of pressure to your kidney. So don't do that. Okay. Reduce taking oily, spicy, and acidic food. So by taking water, sometime when you do activity, you sweat a lot. That time you can take a lot of drink. You can drink by glasses, because the more you drink, the cells are hydrated, so it easily can penetrate to it. But when your body is not hydrated, don't go for glass by glass. Go sip by sip. Okay. We go some more. Okay. Examples of arthritis. Okay. This kind of rheumatoid arthritis, you see all the joints start to things. End of the day, you can't bend. So the fingers will be not free move. So you start to have pressure on it, and you will have a pain, very highly pain, very high pain, and a lot of people suffer from it. So you have to do very small exercise, put a Gano oil massage. You can soak your hand every day in the salt water or Epsom salt water or Himalayan salt water. Apply with the Gano oil every day, massage it until the movement back to normal. Okay. And osteoarthritis more happen to your cartilages on your joints, okay, on your knee. And this will start to impact all these things. Why these cartilages break down? Because the acidity start to damage, start to penetrate into the cartilage area, it become hardening because it's crystallized into the soft cartilage area. So this guy going, it's like a shower points that in the long run, when you keep on shower, you can see some of the chlorine go and penetrate into that, become a plaque. Okay, then the water cannot flow properly. So once you clean the plaques, then you can see the water can flow, so you can have a good shower. Otherwise, some of the hole will be got open, some of the closed. Same thing happened to your joints. Okay, from the day one you born, okay, this cartilage keep on utilizing, keep on creating. Okay, and suddenly when you have a problem, means that your body in acidity level in your body is increasing. You must remember one thing: when you do a blood test, you can't see the uric acid very high, because now all the uric acid already penetrate into your body, in your system, not in your blood. Okay, for example, like dirty water, you can see the drainage is very dirty, but you can see water is still clean. So means that when you check the blood test, oh, you don't have uric acid, the doctor will tell you don't have uric acid, but you still have the pain on the thing. Why? Because it's already penetrate into your system. So it already crystallized into system. So in a blood, we can't see the crystal. Okay, we can't see the crystal. Okay. And some of the things you can see, osteoarthritis happen in the ankle area. Okay, ankylosing spondylitis, very painful, inflammation happen in that area. Then you saw a lot of people have psoriasis, arthritis. Psoriasis happen most of the time happen when the impact of this medication, like steroid, all these things end up your immune system. You are suppressing your immune system. When you suppress more and more your immune system, a lot of things will start to pop up in your body. Okay, that's why suppressing immune is not very good. Okay, and like methotrexate for this kind they will use, that is actually a what you call is using for like a chemo medicine. And also allopurinol they will use. Yes, actually you can slightly suppress your system. You will have a small release, but end up with in the long run you won't work at all. Okay, so when your big finger and it start to penetrate towards outwards, then they call it gout, and the fingers they call it rheumatoid arthritis. So actually you see everything is the same. The problem is comes from the uric acid hydrochloric that inside your stomach is not properly utilize it. Okay, when you properly utilize it, that's why the eating time is very, very important. Once you eat in a correct mode, correct time frame, you are utilizing all the acid to penetrate to the things. Like you want to cook, you put the oil. When you cook at the right time, okay, all the oil is fully utilized in cooking your meal. But when you delay a bit, the oil become dark and become smoke. Now you put your rice, you want to cook fried rice, so your whole rice cannot be eaten. It becomes spoiled. Same thing, acid hydrochloride in your stomach. It been be used, it will come out every day without a single day off. So you must follow the system. Okay, once you follow the system, you can see the changes. So to solve the current situation, the current problem, you can use the solution that I give you: vinaigrette, codipine, ruchilium, androgy, morinzi. All these things will help you to cleanse the system out and balance back your stomach over acidity. And also at the same time, you have to follow the holistic method to balance your system thing. So whatever I have now, you cleanse it out and you prevent from coming in. Okay. So thank you today on this arthritis. So you go back to the stop shares the screen. Okay. So today we have arthritis systems issues, and I think a lot of people understand what is about on arthritis. And remember that everything comes from your own system. You balance your system, everything go back to normal. Most of the people, okay, eat very fast. When you eat very fast, what will happen? Okay, all the food that you eat very fast never break down into small particles, and when enter your stomach don't have teeth or grinder to grind your food, that big particle they enter in. Indirectly, your stomach will use a lot of acid hydrochloric to break down the food into small pieces before sending towards the small intestine. That's why munching is very, very important. Munch your food. Use your saliva as your munch. Why we use the saliva? To make sure the food become more softer. Okay. When you drink water while you are eating, you are diluting the acid hydrochloride in the stomach and also stopping the amylase in your stomach, in your mouth. So when you eat, you must follow the actual guidelines. Okay, this has been trained so many years. What I'm telling you is not 1 or 2 days or new things. That this has been practiced more than 5,000 years by our ancestors. You just to think back, when you're 7 years old, what is your last food time? Okay, dinner 7 to 8 o'clock they give you. Then before sleep they don't give you anything, and they just give you a glass of milk, then go to sleep. The next food next morning you only get. Okay, but nowadays you see 12 o'clock we eat, 10 o'clock we eat, 12 4 o'clock we eat, 6 o'clock we eat, 10 night again we eat. Cannot. The important is only at the 3 meals: breakfast, lunch, and dinner. Tea time is additional. You want to take just a cup of coffee, because you must remember the acid amount that come out when morning 7 o'clock sunlight coming out. When the sunlight start to come out, your body start to know that your body, that is morning already. You can't cheat your system. Automatically our body will change into a serotonin mode. Our hormone will change to serotonin mode, and our body become more active. Once more active, the acid start to penetrate. So in the morning, the acid level, that penetration is only medium level. When the medium level acid is start to penetrate, you only can give a basic food. Okay, basic food means small amount of food, a coffee with the bread, all these kind of things. But when you wake up in the morning, I bring you chicken rice, biryani rice, all these things with chicken, biryani, mutton, all these things. You don't feel to eat, because the amount of the acid that inside your stomach is only a medium level. Okay. When come to 12 o'clock, the sunrise become very peak. When the sunrise very peak, on the peak time, your acid in the stomach will be more. Now high acid has been used. When high acid has been used, now I give you chicken, mutton, whatever I give, everything can be digested, because high acid has been used at 12 o'clock to 1:30 p.m. Okay, that's why you can eat what banana rice la, what la, with chicken la, with mutton la, semua boleh. Okay, semua boleh. But when come to 4 o'clock, you only have a low enzyme that only can digest a small amount of kueh and a small glass of tea or coffee or whatever. You cannot eat too much. You cannot. Okay, a small amount. Okay. Then when come to 6:30 to 8 o'clock, you go back to your medium amount of acid hydrochloric. And this time you can't eat a high meal. You only able to eat like a small meal that you're able to eat in the breakfast time. That is the reality. That's why in the night time we can't eat too much. When you eat too much as lunch, your body, your stomach will be bloated. A lot of people start to eat too much in the night time. They will have a bloated stomach, because your liver don't have enough acid to digest the food that you put inside too much. But when you put 12 o'clock in the lunchtime, the liver has the process to digest, because it has a high acid. But in the evening, you have a small. That's why we only eat rice at the lunchtime, not the morning or not the evening, night dinner. So breakfast and dinner, you can take an equivalent food, but lunchtime you can take a heavy food, because we have a high acidity that is naturally happening in our body. So we need to understand the body system, how it works. Once we understand how the body works, we work accordingly to the system. Once you work according to the system, your acid is fully penetrated towards the food that you're given. Otherwise, the acid will go down into your small intestine and absorb into your bloodstream. Day 1, day 2, day 3, day 4, 365 days, the acid keep on penetrating. You also delay eating, you are late sleeping. Everything is delayed. The acid keep on popping up, entering your bloodstream. Where it goes, it start to trap into all your joints, because that is the empty space that you can trap. For example, how you can see this, you see a drainage. You take a dirty water, you pour into your drainage. Okay, you can, after that, after the water flow, you can see the water not equivalent dirty. Some areas spotted, some area not spotted. The area that have a hollow, they will be spotted with the dirty water. But the area that flat, the water start to move around. So all the joints area, there's a hollow area. But in the straight area, you don't have a hollow points. It's a straight flow. So that's why the joints start to penetrate. So all these acids start to penetrate into the joint and keep inside the joint, because the blood start to carrying in. When carrying in, you start to storage it into a joint area that has an empty slot. So when every day, 365, 1 year, 2 year, 3 year, the penetration start to attack your system. Okay, the thing become a crystallization. It's a mild crystal, the medium crystal, then the heavy crystals, then become inflammation, then become very bad, then you can't move your finger, you become more. I've treated so many arthritis patients. It takes me 6 months to 1 year for them to walk freely and drive. I've treated so many patients that cannot walk arthritis. Okay, because that is the last stage. You go hospital, no treatment at all. The moment they can operate, take it out the acidity, they take it out the crystal only. But it will keep on forming because you never change in your lifestyle, and also cleanse it back the old item inside your body, the toxin in the body. So very, very important, you must understand the time of food is very, very important. A lot of people say, you go into your hospital, you ask doctors, they will tell you, oh, don't eat peanut. Okay, then say what else they say? Don't eat meat. Okay, don't eat seafood. But you ask them back, why this one cannot eat? Okay, you have to ask them back, why cannot eat? Okay, they don't teach you how to eat, but they will stop you from eating everything. When they stop you eating everything, and what are you going to eat? You see kacang, you want to eat. You eat sotong, you want to eat. You want to see, if you see prawn, you want to eat. But a lot of people eating, no problem. When people are following a correct way of eating, everything is become a food in a proper way, digested in proper way. The problem is, first thing we take kacang. I give you one pack full of kacang. What you will do? The peanuts, you just much. In half an hour, you finish your one box of kacang. You never munch it properly. You break it into 2 pieces, you just swallow. You break it in 2 pieces, you just swallow. Most of the kacang inside your stomach, the peanuts inside your stomach, when you open your stomach, you see here, it's not breaked. If it not break into particles, okay, now you think the stomach will push into your small intestine? It won't do. So all the stomach, you take all the peanuts, put in your sinky. Your sinky is big, the pipe is small. Okay, it will stuck inside. So you need to powder it. So if you eat kacang, powder it nicely, break it into a particle, powder it, then you swallow. Now no problem. Everything can penetrate into your small intestine. So nothing problem. Okay. Second thing, a lot of people say don't eat seafood. Why seafood? You see, other than fish, squid, prawns, crab, all these kind of meat, you see, after you cook, it become like rubber. But when I give you a prawn, you munch 2 times, you just swallow. It's the same thing. It's stuck into your stomach. It become like a rubber. Now the whole prawn, you only munch into 2 pieces, you swallow in. The 2 pieces that inside the thing cannot go penetrate into your small intestine. So it's stuck in your stomach now. Now the stomach don't have anything. You don't have teeth. You don't have grinder. So you use the acid hydrochloric, put into that the prawn or the crab meat. It break into, you put until it become very, very tiny particles. Then only push into your small intestine. At this time, high acid inside the food ready. The acid hydrochloric utilization is very high. Instead of 10 ml utilization, if you munch, but because you don't munch it properly, now the stomach need to use 100 ml of acid hydrochloric. Now all the 100 ml of acid hydrochloric go together into your small intestine and penetrate towards your bloodstream. This will, end of the day, you leakaging all the things. You start to penetrate all your joints. Okay. Then what else? Meat, red meat, same thing. You eat meat, beef, kambing, mutton, all these things you are eating very fast. Remember, stomach don't have teeth, don't have a grinder. You must break it into a small particle before some. Whoever eat properly, munch it properly, they don't use high amount of acid in the stomach, and very fastly digested and transfer into your small intestine. Okay, that's why we need to control the acid hydrochloride that penetrated into your body system by itself. So you need to balance it. Nobody will balance it back. So the doctors don't explain you where is the problem is. Then they ask you to stop all the food. Okay. Actually, my patient, I said after they become okay already, I said you can eat, but could follow the exactly. Once they follow the exactly, then they don't have problem. They eat. They're living back. They start to you eat back ready, but they learn how to eat. Okay. We have to teach people to how to eat ready. After so many years, okay, now we have to teach them how to eat. That's the problem of human being nowadays. Okay, clear? So I think any questions? You can put in a group chat, or you can activate the mic and you can ask me. Now 8:51 already.
Doc, there's some questions in the chat group now.
Hey, I don't see anything. Let me see. Oh, okay, ada. Saya di sini ada berpesan. Kalau ada GERD, apa suplemen yang sesuai mereka ambil? Okay. When you have a GERD, okay, that means you eat. People who have GERD always, you see, first thing, they run their time frame. Okay, follow my time frame first. Second, munch properly. Your food is not digested. That means the acid, when you attack the food, the acid is too much, then the air will flow upwards. When the air is flow upwards, you have an esophagus valve here. So there's an esophagus valve start to close already. But the air, because you eat too fast, the air keep on pushing the thing. Then you have a acid reflux and a GERD happen. So the best thing, change your style of eating, munch properly, eat on time that I given to you. After 8 p.m., don't eat anything. Before sleep, just drink a glass of milk, things. So the best supplement that you can take is myco-veggie, morinzyme, lion's mane. That one is very good. Okay, that's the main is that drink myco-veggie, morinzyme, and lion's mane is the main. Others, additional, you can put androgy, RGGL, all these things you can eat, no problem. Okay. Kalau sakit tekak, apa suplemen yang sesuai mereka ambil? Okay, we have to see. If you have a sore throat, sakit tekak, okay, sakit tekak. Sakit tekak ada few type. Some sakit, tapi you don't see redness. That means is drying, lack of water. Not red, but you feel that pain. Means that your throat is dry throat. Tak cukup air, minum air sikit, dan sakit tekak hilang. So you boleh minum like roselle juice, morinzyme juice, all these things. Second thing, you sakit, then bila you check, dia reddish, that is some infected. Bila infected, the best, you buka one androgy, you masuk dalam mulut, ataupun you buka one RG, masuk dalam mulut, suck slowly. Repeat every 2 hours. Then your pain will be totally disappear. Malam sebelum tidur, you basuh gigi, you gargle guna air garam, okay, ataupun air garam ataupun air Ganotherapy toothpaste. You ambil air swam, letak Ganotherapy toothpaste, you bancuh, you gargle guna the air Ganotherapy toothpaste. Air Ganotherapy toothpaste is very good. Okay, toothpaste yang you pakai, you ambil sikit Ganotherapy, okay, the toothpaste tu letak dalam air panas, swam sikit, you bancuh. Okay, you boleh gargle juga. Okay, because they are the mint. Dalam tu ada mint. That mint will help you to cleanse the thing. After that, you ambil satu androgy. Kalau you boleh tahan pahit, you buka satu androgy, you tuang dalam mulut, you just suck and you just sleep. You just tidur dengan androgy tu. You jangan minum air. You just letak, you suck, you terus tidur. So the all day night, the androgy will be all penetrated here. The next day morning you wake up, you sudah baik. Sudah normal dah. Okay, this is very easy treatment. The androgy is very powerful. Kalau you tak boleh tahan pahit, you boleh guna RG. Okay, you boleh guna GL. Okay, macam budak kecil susah. You just buka satu GL, you just put in your mouth. Dan jangan bagi dia air. Okay, ask them to gargle it. Kalau budak kecil tak boleh gargle, so you keep on giving a GL sajalah cukup. Okay, GL saja cukup. And after that, you just makan androgy satu kapsul 3 kali, GL satu kapsul 3 kali, and minum morinzyme ke roselle ke panas. Roselle jangan ambil yang sejuk, minum air roselle panas, ataupun you suck the tablets lah. Then slowly dia akan okay punya, very fast dia akan okay. Androgy is very powerful. Okay, clear? So we see another questions. One, any recommendation for detox age 45? Okay, detox actually very simple. Okay, when you eat a cracked food, is considered detoxification. When you eat in a correct time is considered detoxification. The actual detoxification always happen after you sleep. So that's why 8 malam is your last food you take. Don't take anything after that. Because our organ, the hormone will 9 to 11, the hormones start to penetrate with the hormones start to balance. 11 to 1, your gallbladder detoxification started. 1 to 3, your liver detoxification started. 3 to 5, your lungs detoxification started. 5 to 7 a.m., your large intensive detoxification happened. That's why 11 to 7 a.m. we should not eat anything. 11 malam sampai 7 pagi, detoxification every day berlaku secara naturally in your body. That time you tidur. That's why body rest is important. Sleeping, okay, got two category. One, mind sleep or body sleep. So as a human being, kita cuma boleh bagi body sleep. Mind sleep tak boleh. Mind sleep is controlled by the system. You tak boleh minta sistem tutup saya punya brain, tak boleh. Okay, kita cuma boleh bagi a system with the body sleep. You give a body sleep, the mind will follow. After that, wake up sekejap, mind will follow again. Wake up sekejap, tidur sekejap, mind sekejap. Tapi your body will always in a sleeping mode. Okay, so you have to follow that. And best things you can take RGGL ataupun kalau you nak betul-betul detox, best one you take a Mycovita. Mycovita 1 sachet 1 liter air. Okay, biasanya I akan kata 500 ml half sachet 500 ml, Morinzyme 50 ml. You shake, you minum daytime. Then after lunch 2 o'clock you letak 500 ml, letak lagi half sachet balance, letak Morinzyme, goncang, you minum sampai 7. So 7 to 1, okay, 2 to 7. 7 to 1, 2 to 7. So 7 to 1, 500 ml water with half sachet of Mycovita, 50 ml Morinzyme. 2 to 7, same thing. Mycovita half sachet balance. So 1 hari 1 sachet. That is the best thing. Kalau you nak go for basic, you can go for RGGL. You makan 2 capsule RG, 2 RG, 2 GL, morning 2 RG, 2 GL, evening 2 RG, 2 GL. So you continue saja. That is detoxification will automatically happen. And additional, you can letak spirulina, black cumin, all these things. Main detoxification document is a Richelieu. It's a RGGL ataupun Mycovita. It's the same lah, huh? It's the same. So when is the best time to take SPM supplement? Okay, the extent actually very simple. When you want to take supplement, very simple. You always take before breakfast 30 minutes ataupun after breakfast 30 minutes. So always remember 30 minutes before your meal time. Boleh 30 before, boleh 30 after. So maintain that. Then should be okay. So there's no best time, but you just maintain that things enough. Okay, what causes a bone spur? Okay, bone spur actually when you're getting older and older, the bone spur normally happen. Okay, sometimes the bone become very stiffness because osteoporosis happen. When osteoporosis happen, sometimes some of the spur will start breaking of the small portion of the bone. You see, bone kita ni, when you're getting older and older, the small osteoporosis happen. So the small bone that crushes will be connected into one small area. They will start to penetrate in one area, the breakable. Abuk, kita panggil simple, abuk daripada tulang-tulang yang dah rapuh in your body. Sometimes they will drop. They become a small portion, one area, they macam spur. Okay, so that's why you can actually you do in that spur area every day night. Okay, you soak at the Epsom salt atau Himalayan salt. After that, you take Gano oil, you put that area, you massage with your finger. You do the 2 finger, you just massage every day. Once you keep on massage, the small spur akan dissipate, dia akan break down lah, dia akan jadi normal balik. Because we have a lot of this kind of cases. So it's like a small bones that drop lah into a one area, then become like a one small bone lah. Then we already say bone grow lah, bone apa lah. Actually, it's not growing lah. Actually, spur from the small bones that osteoporosis happen. The small breakable bones start to connect. Macam abuk. When you see in your table kan, ada abuk banyak. You bawa semua abuk letak dekat satu tempat. You just see, it's quite a lot of abo you usually see. Okay, that become like that. So when you keep on one place, it become a small table. In the table, there's a small like a board, like it will happen there. Okay, so any other questions? Did I answer the questions? Okay, Marianne?
All the question answered, Doc.
Okay, so good. So actually, that's why very important to make sure what's happening and remember all the information that are given to you all. Okay, in a modern medication view, arthritis no treatment at all. It's unknown causes. They are still putting it under unknown causes, and the best they can suppress your system, but in the long run, you're actually damaging the whole system. So don't do that. Best is use the nature ways, balance back, learn what I teach you all, follow. The one that I'm telling you is already proven. Okay, already proven. Okay, in 18 years already proven. If it proven, that is a real theory. Okay, if it's not proven, it's not a theory. You go hospital, you can see people like 10 years they're doing the same thing, go and take, go and take, go and take. After that, the more they go and take, the end of the day, from walking, become slow walking, end of the wheelchair, then bedded. Abyss. Cannot do anything. Cannot do anything because too much of the chemicals they put inside until the body unable to remove all the toxic from the body by itself. Okay, you are damaging and killing the body by yourself. You are damaging yourself. Okay, so clear. So it's already 9 a.m. So if no further questions, we'll end up the session today. And Selena, the next session will be
2nd of March, Doc.
2nd of March. Okay, we will see on the 2nd of March. Let me think what kind of topic that I will come out. If you have any idea of the new topics, okay, just let Selena know. Maybe telling me earlier because I need to prepare the slides for all these things and have to prepare some information for you all. Okay, so you have some time for that. Okay, clear? So good. Okay, so thank you very much for this today's session. So hope to see you all in Kuching and Meria sooner. So I think the flights start to coming and then stop again. They're coming again. Okay, see whenever it's got time, then we will come and meet you up all. Okay, thank you.
Yeah, thank you very
Thanks,
much, Doc.
Doc.
Good night.
Thank you, Doc. Good night.
Have a nice day.
Good night, everybody.
Thank you, Doc. Good night. Thank you, everyone.